Welcome to episode 5 of the Pocket CI podcast. I'm your host, Dr. John Schaefer. And today we're going to be talking about finding your flow. So, this is one of the topics that I'm most passionate about because I think that during clinic rotations, this is what it all comes down to figuring out who you're going to be as a physical therapist, how are you going to practice, and how you're going to take different components of each clinical instructor that you work with to create how you end up operating as a PT. Just got to plug my laptop in here. Yeah, so we don't die during the podcast. But the goal for today is we're actually going to go through an example of a clinical examination, and then we're going to talk about how you can build your own clinical exam. Because at the end of the day, your CIs are going to tell you how they do things, but that doesn't necessarily mean it's how you need to do things. And I think that a lot of students feel pressure on their rotations to practice in the exact same way that their instructor does. Otherwise, they're not doing things right, or they don't think they're doing things right. So pay attention to as you're on clinic rotations, just what sorts of things you like, what sorts of things make sense to you that your CI is doing, but also, question those things. You're like, wait a second, this isn't really how I would do things, or like, I've got more questions about this. Ask your CI directly. You're not necessarily challenging them. You're not always going to change how they practice, but you can at least give them different things to think about. Because a lot of times CIs will be like, oh, like it's nice to think about things with a fresh lens because you're a lot closer to the textbooks, you're a lot closer to the research where you can bring new ideas to your CI. So they always appreciate that. So I'm actually pulling from the Pocket CI playbook right now, and we're going to go through the section that's titled Find My Flow. So for the subjective exam, this is a component of the exam where I'd say there's definitely some pieces and some advice that I would give everyone to make sure that you follow through. Again, you can make this your own, but at least have the same concept or the same ideas in place. So the first thing is going to be the initial encounter, but like before you even meet the patient, before you start the subjective exam, you're going to bring them back and you're just going to get a feel for things. You're kind of going to ask them, hey, have you had physical therapy before? If so, what's your experience been? If you haven't had physical therapy, that's a great opportunity to explain what PT is. You can say that, today we're going to go through some different questions, get an understanding of where you're at, how you're doing before this injury or setback, and what we can do to help you reach your goals. So that kind of disarms them, gives them an idea of what to expect. Then you can say, like, we're going to start with the questions, and then we're going to get into a little bit of movement, see how strong you are, how mobile you are, all that good stuff. And then once you actually get into the questioning, this is something that's important too. So you can have a different approach, like decide what kind of clinician you want to be. Do you want to be someone who is like more conversational, more direct? Do you want to be warm? Do you want to, come across as very professional? It really depends. There's not a right way or wrong way to approach it as long as you have an idea of like, this is how I want to show up. I'm gonna close my door because I think there's some birds or something here. Okay. Yeah, I don't think that's gonna help tremendously. Now we got the Zoom going crazy, but that's okay. So after you decide how you want to present, like how you want to come across as a therapist, the next thing to think about is the fact that there's certain questions you have to ask every single time that you see a patient during a subject, and there's also questions that can wait. So for me, we'll just go through like some of the things that I think are most important or that really you should have in your subjective. And again, you can expand on this, you can make it your own, but this is kind of like a baseline. So if you've got a sheet of paper, you can write some of these down. If you don't want to write it down, if you want to reference my resources later, again, this is all from the Pocket CI playbook, which is listed in my bio, and you can check out if you feel like that might be helpful. So part one is you're going to establish a timeline. So figure out when the pain or injury actually began. So you can figure out if it's more acute, chronic, subacute. And then you're going to ask about the mechanism of injury. So was there a specific event that caused the injury? Then you can ask about aggravating or alleviating factors, ask about pain levels, I think 0 to 10. If there's any descriptors, I used to think descriptors were a big deal, but really they don't always give you a ton of information. If people tell you that if people tell you that it's sharp, that's going to raise some red flags, but also if it's just like dull, then it's not as big of a deal. So I'd say sharp is kind of the main thing to listen to or pay attention to. Next, you're going to ask about the home setup. If they've got family support, that's always important to figure out like what sorts of resources they're dealing with. Ask about responsibilities they might have, and then any hobbies or things they enjoy. So make PT meaningful to them. Because at the end of the day, if you're not connecting things back to what matters to the patient, they're not really going to have that much buy-in. And then ask about goals, and then at the end, you can do a systems review, which is just asking, questions to rule out any red flags. I do a top-down approach, so it's starting with the head. I'll ask about like headaches, dizziness, changes in vision, then move down to the chest area, and you'll ask about like shortness of breath, tightness in chest. You can also ask about nausea, vomiting, GI issues, and then if warranted, you can ask about like urogenital concerns or history of cancer. But that's just kind of a skeleton. That's what I ask. And then when I get to the end of my subjective, I'll always be like, is there anything I didn't ask you that you feel like is important for me to know? Patients appreciate this. At the most, they'll give you additional information. At the least, they'll be grateful that you asked and feel a little bit more connected. So that's the subjective. Once we get into the objective portion, this is where I want you guys to think about building your flow. And your flow is a repeatable pattern that you can perform with every single patient or client that comes into the clinic who has a injury to that area. So I've got flows for my lower quarter, I've got flows for the upper quarter, and I also have a post-operative flow that I go through. So regardless of the specifics of the injury or condition, I'll go through the same pattern. And the reason this is helpful is because once you start to go through this exact same flow every single time, you'll have a huge database that you're building in your head of how patients move. You'll say that, this is what looks normal, this is what doesn't look normal, this is how this condition presents, this is how that condition presents. So a lot of times when students look at their clinical instructors, they're like, oh my gosh, like they're so skilled, they're so confident. Well, that might be the case, but also they've developed this huge bank of patients and movements where they can pick out things a little bit quickly. And what that's called is pattern recognition. And that's not something that you can really study your way to. You just have to go through seeing lots and lots of patients, but you can speed run your pattern recognition development by developing your own flows. So I'm going to give you, we'll try and keep this podcast relatively short. So we'll go through my lower quarter exam flow, and then we'll just talk about how to write your own exam flows. So to write your own exam flow, what I would do is I would start with listing out the various positions. So that would be standing, supine, and prone. And then under each category, what you're going to do is you're going to write out what sorts of movements or tests that you want to look at in those positions. So for the lower quarter exam specifically, again, you can write this down if you want. Otherwise, resources are in my bio. But for standing for the lower quarter, do a postural assessment. Then I'd look at lumbar active range of motion, cardinal planes, have them move forward, backwards, side bending, rotation. And then after that, I have them go through a squat and do single leg balance. And then you can also have them walk and look at their gait if you didn't already do so on the way in. Then I always have them perform heel raise and then look at 30-second sit to stand test, as well as additional functional testing. You could look at the tug, 6-minute walk test, or anything else that you feel like is important. After I have them in standing, the next thing we'll do is we'll get into supine. So I'll tell them, hey, let's get on the table here. And then I'll do a lower quarter screen. So this is looking at hip flexion, external rotation, internal rotation, knee flexion, extension, and ankle range of motion. So this is very quick. They're on their back and you're moving their leg, you're moving their ankle just to assess all those different joints. And then you can do any hip or knee special testing as indicated. Again, this is some of those pieces you're going to pull from the subjective. So based on what you hear from the subjective, you'll say, okay, like maybe I need to perform a scour test. Maybe I need to do, X, Y, or Z tests. The next thing to do is measure any deficiencies. So if there's any deficits in like range of motion or strength, you can test those as well. And then I always have patients do a straight leg raise, a bridge, bent knee fall out, and then do some manual muscle testing as needed, just depending on where they're at with everything. And that should give you a pretty comprehensive overview of some of those joints to help you have a better understanding of what's going on. Then I'll have the patient flip over in prone, and you can do a joint assessment for lumbar spine. You can do sacral rocking, prone press up, and then standard or modified plank. So that's how I would approach things. But again, this is totally, totally up to you. Some of those pieces are super helpful. Other pieces, you might feel like don't give you as much information. But for me, those are the movements that I want to look over, and I want to make sure that I'm building that bank in my head so I know how those different joints feel in the lower extremity, how they move, how people move when they squat, when they do heel raises. I've got this, standardized. I've got the norms down for 30-second sit-to stands, some of those functional tests, and I can compare against each other. So that's what's important to me. And then once you get to the end of The objective exam. So again, this is just for the lower quarter. It's also important that you've got one for the upper quarter and then also for post-operative patients. But then you're gonna have to deliver your summary to the patient and tell them like what you think is going on, what you found. And I think students put too much pressure on themselves here to have like a mechanical diagnosis when really there's differences in diagnoses. So there's a mechanical diagnosis and there's also a physical therapy diagnosis. So the physical therapy diagnosis could be, range of motion deficits or, weakness in specific muscles or things like that. So it's okay to tell a patient, look, I think the problem, like you're having all this pain because you've got a severe limited range of motion in the knee or in the hip, or because you're weak in these muscles. And if we fix that, if we address those deficits, then you're going to start to feel a lot better. You're going to be able to move a lot easier, and things are going to feel better. Like your problem will be solved. So you're going to have some patients who press you for more mechanical diagnosis. In those cases, it's okay to get more into the anatomy and like label things. But for a lot of patients, giving them that physical therapy diagnosis is going to be just fine. So hopefully this was helpful in encouraging you guys to recognize that there's no one right way to do things. But I also at the same time want to give you examples because you don't want to ever start from scratch. It's very helpful to have a general idea of what sorts of things you should be thinking about, what sorts of movement you should be watching, and how you should go about talking to your patients in the general flow of a session. I think that's one of the most important things you can get from your CI is just watching and observing how a physical therapist moves throughout their day. Because if you don't have that reference point, you don't really know like what am I doing? Is what if I can talk is what I'm doing inappropriate, appropriate, and like what's the best way to move forward and progress as a physical therapist? Because we ultimately, at the end of the day, we become some version of a combination of all the CIs we have. So if you've got great CIs, you're gonna likely become a great therapist. If you've got CIs who are less engaged, more withdrawn, don't care as much, aren't answering your questions, you're probably unfortunately not going to practice at as high as a level. So that's really the goal with the Pocket CI is to make sure that we're raising the standard of clinical education across the board. Regardless of who you have as your CI, we're going to make sure that you know everything that you're expected to know in the clinic, but maybe aren't taught in the classroom. And so if you want more guidance just in terms of building your flow, finding out what kind of clinician you're going to be in the clinic and knowing like what opportunities are out there in the field after graduation too. I would highly encourage you guys to check out the Pocket CI playbook. It's 6 modules, 22 lessons. We talk about stuff like this and we cover really everything in between that I wish I would have known while I was on clinical rotations and then early on in my career too. If you guys are enjoying the podcast, I'd really, really appreciate a 5-star review. Any feedback you want to send me on Instagram as well at the Pocket CI. I'm more than happy to cover different topics that you guys are interested in or just answer questions and have conversations with you guys. Because at the end of the day, this is about you. This is about making sure you're comfortable with where you're at on your clinical rotations and in PT school, just so that you can end up, making the most out of this career and the degree that you pursued. So thank you guys so much for being here. Have a great week, and we'll talk to you soon.